Welcome to Indiana News Desk. I'm Joe Wren. Well, it's been about 6 months since the Trump administration declared a nationwide public health emergency due to the opioid crisis. But many are wondering what's changed. Trump says federal leaders will roll out a policy plan in the next few weeks. As Lindsay Wright reports, local advocates hope to see less talk and more action.
Overdose Lifeline has been at the forefront of the opioid crisis in Indiana for years. Up until recently, founder Justin Phillips says the group was crammed into a small space with little storage.
We just, had outgrown the space we were in because we've got intern participation from both Purdue and IU and added a staff so we could fully implement our prevention program. Okay, here we go. Space. Yep.
The organization moved into a larger space about a month ago, so they can continue helping those impacted by the opioid epidemic.
We had the naloxone off-site in a secure storage. Now we can do it here, which is so much better for us.
And still, more than 100 people in the country die every day to an opioid overdose. Drug overdoses in Indiana are growing faster than the national average, and death rates involving synthetic opioids doubled between 2015 and 2016. Phillips says we can't keep talking about the issue. It's time to act.
We don't have time. Honestly, we don't have time.
National leaders promised more action at a White House opioid summit last week. And you might recognize some of their faces, including former Indiana Health Commissioner Jerome Adams, who's now Surgeon General.
My brother Philip is in prison due to crimes he committed to support his addiction. His illness has affected my entire family, emotionally, medically, and financially.
Health and Human Services Secretary Alex Azar says they've been working to increase treatment and implement prevention and response efforts. He says states can also get waivers for Medicaid to cover medical-assisted treatment like methadone or Suboxone. He says it's essential. He also says Trump's budget proposes doubling state grants for prevention and treatment from $500 million to $1 billion a year starting in 2019.
To support that grant program, we announced a new method of technical assistance in November to use more local experts and expertise to provide technical assistance to states and grantees rather than a traditional one-size-fits-all approach from Washington.
Associate Professor Dennis Watson says that's what it's going to take to actually make a difference, and Indiana needs to hold national leaders accountable.
Things at the national level, they can trickle down somewhat, and they're going to states in terms of like policies that make certain funding available and things. But at the end of the day, it's the states figuring out how to use it.
Watson says research shows opioid use decreased by more than 30% within 6 months for those using medication-assisted treatment. But he says people need social support too.
If you don't have a job and you don't have a car, how are you going to pay for treatment and how are you going to get to treatment? And those are the things that we leave out of programming.
HUD Secretary Ben Carson touched on the lack of sustainable housing options and other social barriers for those with addiction. President Trump suggested harsher penalties for drug dealers and even opioid distributors.
Hopefully we can do some litigation against the opioid companies. I think it's very important because a lot of states are doing it. But I keep saying if the states are doing it, why isn't the federal government doing it? So that'll happen.
Several Indiana counties have announced lawsuits against opioid manufacturers. While officials continue discussing the issue, Phillips says her organization is trying to move past that by implementing an online program so people can access information.
These programs, specifically the opioid public health crisis that we have, is about everyone having the same piece of information so that we don't have to keep having the summits, but instead we're all on the same page. Community, here we are.
Thank you cards she received from 9th grade students show her taking action is what makes a difference.
Honestly, the day you came, I was thinking of going back to doing pills. You coming really helped me see that there are other ways to deal with depression. See, that is like one potentially life we change, and I don't care about the rest of it.
For Indiana News Desk, I'm Lindsay Wright.
Trump says the policy plan that will be rolled out will be a strong one. Other national departments say they're working more than ever to crack down on illegal drug trafficking and preventing drugs from entering the country in the first place.